a Netflix original film.
The Wi-Fi isn't working.
In the event of a global communications breakdown, do the following. Stay inside.
What just happened here is happening everywhere.
Avoid strangers.
We've all been deserted.
I don't trust them.
And most importantly, do not panic. Julia Roberts.
What happens next?
Mahershala Ali.
I knew something was coming.
Leave the World Behind. Rated R. In select theaters now and on Netflix December 8th.
Hello, Beat Check listeners. I'm Shane Dixon Kavanaugh, Portland City Hall reporter for the Oregonian Oregon Live, and your host this week. In 2019, Portland's lone drop-off center for people experiencing severe intoxication from drugs and alcohol abruptly shuttered. The closure left a massive gap in how Oregon's largest city could respond to those in the throes of visible and often dangerous bouts of crisis. Just as drug use and overdose deaths began to soar in Portland and around the state. Dozens of local leaders began immediately working on a plan to replace Portland's decades-old sobering station. But after 4 years, the effort largely collapsed this fall. The fate of a new and desperately needed sobering center in Portland remains uncertain, even as other communities throughout the state successfully create their own. Joining me today is my colleague Maxine Bernstein, who recently spent a bit of time digging into how this spectacular failure occurred. And Max, thanks so much for joining me today.
Glad to be here.
I think that easiest place for us to start is just to sort of set the scene for now where we are in this discussion and get a better sense of the stakes here. Like, what does the lack of a sobering center in Portland actually mean? And why does this matter so much?
Sure. Well, the city for decades, for at least 3 decades, from 1971 through 2019, had a safe place, what was called Central City Concerned Sobering Station. It was a location where police, firefighters, paramedics, first responders could take someone and drop someone off who was intoxicated on the street and cause a potential danger to themselves or others, and let them sober up, dry out. It was an alternative to jail or hospital emergency departments. There were also roving vans. It was called the Cheers van that this nonprofit helped run that would roam around the city and pick people up and get them to a safe place for a few hours where they can come down from their intoxication and be safe. And that went away at the end of 2019.
And we'll get into the reasons for why the sobering station suddenly closed in 2019. But since then, in the last 4 years, in the absence of having a dedicated drop-off center for people who are highly intoxicated from whether it's alcohol or methamphetamine or heroin or now fentanyl, where are people in those states going, if anywhere?
They're generally either staying on the street or ending up at hospital emergency departments and might wait there for hours and be seen and then immediately released back into the street. Sometimes they're taken to Unity Center for Behavioral Health, which is the city's, it's really a psychiatric emergency department. But police were finding Unity Center wasn't really set up to deal with people who were also high on meth and might be aggressive. And those people would be taken there and also would be quickly released and end up back on the streets. And sometimes these people would end up in jail.
And so while we've had the closure of a dedicated sobering center in Portland, I think most of our listeners know or have observed and experienced firsthand that there has been also just an explosion in open drug use in Portland, and what appears to be individuals for whatever reason having severe addiction or behavioral health crises in public places. So the closure of the sobering station kind of coincides and dovetails with this very dramatic increase in, for lack of a better word, visible intoxication. Is that correct?
Well, when the sobering station closed in the end of 2019, the big problem were people who were intoxicated from alcohol, but also co-occurring meth addictions and also mental illness. And since then, fentanyl has fueled enormous epidemic of drug overdoses in the city and state. So that's also complicated the matter.
And as you reported in your piece, and for our listeners, we'll have a link to Max's phenomenal story in our show notes, and I encourage everybody to read it as well. But in your reporting, you show that leaders in the city, whether it's government or healthcare or addiction service folks, immediately recognize the need to replace the sobering station that closed in 2019. So a group of people quickly came together to start thinking about and planning for the next iteration of what a detox center in Portland might look like. Tell us a little bit more about who this group of stakeholders were and what did they set out to do exactly?
Sure. So there was I spoke with a woman, Laura Cohen. She was at the time a supervisor at Cascadia Behavioral Health Care. And a lot of people who were working in her office were coming to her because they couldn't find a place to place people who were in acute distress from intoxication or mental health matters. And she also was talking to the county judge who runs Multnomah County's mental health court, who was also looking for alternatives of all the people who were coming into her court, who she was seeing, who were cycling in and out of hospital ERs and jails, but not getting the help they needed to stabilize. So she realized that the closure of Central City Concerned Sobering Station would provide an opportunity to look at really what the city could do to build and provide a sort of a bigger, broader center that would accommodate people with these co-occurring, alcohol intoxication, meth-induced psychosis, and provide a safe place for them while also offering police and firefighters a one-stop drop-off center where they can quickly take people to ensure get them off the street so they are safe and are not a threat to others. So Laura Cohen actually reached out to the city of Portland because at the time the city was funding Central City Concerned Sobering Station. So with that closure, she reached out to Mayor Ted Wheeler's office, and there seemed interest in trying to get a broad group of people. It was, healthcare executives, addiction service providers, police, hospitals, coordinated care organizations, peers who had lived experience and had gone through, substance abuse treatment, together to try to envision an alternative to. And so Mayor Wheeler brought in a retired Portland Deputy Police Chief, Bob Day, to lead the effort.
Who's now the current police chief of Portland, correct?
Right. He was just appointed police chief. But at the time, he was a retired deputy police chief, and he worked as a staffer in Mayor Wheeler's office, trying to get everyone together. And, this broad new group mapped out a vision for what would be a substantial upgrade from what previously existed, and a place they envisioned would be able to handle the, people, who are profoundly disturbed, agitated by fentanyl, meth, or alcohol use and mental illness. And no longer would police and firefighters have to be on the street and try to figure out, what someone's problem was. Should I take them to the ER or Unity Center? They would take them to one front door, one focal point, and there you'd have psychiatrists, peer support, doctors, nurses, and they would assess and triage people.
And so just a quick pause here. In terms of the entity that would largely fund or operate something like this, at the time, was it envisioned that the city of Portland would do this exactly? Because it sounds like you mentioned Ted Wheeler getting brought into this early on, and it's a small but significant distinction. We know that Multnomah County is primarily tasked with addressing behavioral health and substance use issues in the county, but also a drop-off center like this is something that first responders, which is a city of Portland deal with firefighters and police officers, would be using it to take people there. So kind of in terms of governments or who would need to run this thing, how did that work?
Sure. So Laura Cohen, who had originally gone to the mayor, also had approached the county as well at that early time. And the county provided, there were people from the county who attended these initial brainstorming meetings, but the county stood back, was not going to provide any funding, even though the county is the local mental health authority for the city and county.
So why weren't they going to initially fund this?
There's a lot of people I spoke to said it was their feeling that the then county chair, Deborah Kafoury, that her focus was a different center and opening what is the Behavioral Health Resource Center in downtown Portland, which is sort of is a day center for people who are homeless to come in, take showers, have a place to rest for a few hours, but not for people who are intoxicated in acute crisis. But she was focused on working to fund that center. And there was this feeling that that was her focus, and there was a bit of a competition. She didn't want to get involved and felt, the city had funded the Central City Concerned Sobering Station. It was their responsibility, but had county representatives at the meeting.
And just one other question for you in terms of context and helping our listeners better understand. I think historically, when we talk about a detox center or a drop-off place for folks who are highly intoxicated and dealing with the effects of that, often we have described these types of places as drunk tanks, for lack of a better word. But just to be clear, I mean, the type of center, drop-off center that you're talking about in terms of what this group of stakeholders were coming up with and envisioning was something far more expansive than just a place for people to essentially dry out, right?
Right. There would be initial intake and assessment of what their problems were, and they would likely be placed in a safe area for hours to sober up and to dry out. But yet after that, they would be connected to further services, whether the next step, if they're interested, is detox, which is sobering is not a treatment program. It's usually it's a short term, 4 to 12 hour period, community-based program that monitors people during their intoxication. Its goal is to reduce harm and help people return to a baseline. But after that, the idea is that if they're willing, they would move on to detox, which is like medicated, supportive withdrawal, complete withdrawal from alcohol or drugs, and also be provided, a case manager, peer support, mentor to help them. And then, the next step after that would be connections to supportive housing and recovery. The whole idea was to have one door where police would take people or firefighters, and they could really assess, what the problem was in the community and what the need is.
So we have a group of leaders that come together from a broad range of professions and backgrounds. They agree on a particular vision for what this type of drop-off sobering center should look like. They detail this out over the course of a couple of years. So what the hell happened?
So Bob Day realized that, he realized that, he couldn't do this alone. And he suggested someone with a healthcare background or healthcare management background take this further. And so one of the groups, Care Oregon, brought in a consultant, Aaron Loans, whose Loans Consulting Company, and he basically facilitated this. It was called what became the Behavioral Health Emergency Coordination Network, shorthand for Beacon. And they saw this as the focal point, the bright light, the one spot where first responders could take people and provide help. So he coordinated, and this was during the pandemic. This is during 2020. So there were at least 80 groups involved. They were holding meetings via Zoom.
Wait, did you just say 80, like 80?
Yes, 80 groups, 200 so people, and there were multiple subcommittees. They were looking at, what's the best way to transport people? There used to be this Cheers van, but what's the best way to transport people? What's the best way to fund this? How should it be set up? What type of security should there be? There was a whole directory put together of people with lived experience, and they had their own committees, and they met with judges and the police, and they shared what they thought was needed. So he was compiling all this information throughout 2020, and then there was Measure 110. They saw that as a potential funding source for this idea they had, and they presented a proposal for funding from Measure 110. And there was a subcommittee of community members that decided, that looked and reviewed the proposals. And
this is a Measure 110 subcommittee.
Yes.
Okay.
And this Beacon network sought $1 million of funding from Measure 110 money and presented a proposal, and they listened, on Zoom, and they couldn't answer questions. They didn't have a chance to explain their vision for this center. So there were like 4 community members who were looking through Multnomah County proposals, and one of the Beacon veteran members was listening to this and heard a community member, recommend against funding the network because it's just a drunk tank, and it was anything but a drunk tank. The whole idea was that it would be a bigger, broader sobering center, but they couldn't provide input there was no chance to take input from those who had submitted the proposal. And then beyond that, so that was not funded, but during the whole consideration for Measure 110 funding, many members of the network were surprised to hear that 2 hospitals had submitted their own proposals for funding, Measure 110 funding, to support sobering beds within their emergency departments. And the members of this network were told me that, they were surprised because the whole idea that they had was to divert people from these overrun emergency departments.
I mean, I remember very clearly, even pre-pandemic in 2019, that hospitals were basically saying that they were completely incapable of adequately dealing with individuals who are coming through the ER, experiencing, like, most commonly meth-induced psychoses. I mean, it was the ERs and hospitals at that time that were essentially saying, we can't take this on. And this is why they were supporting and getting behind the separate sort of one-stop shop drop-off sobering center. And that was one of the things that really surprised me in your reporting, was if that was sort of the narrative that had emerged even before the pandemic with regard to the hospitals and their capacity for dealing with these types of folks, to then have them come in and essentially seek state funding dollars to start providing sobering beds for them. That was puzzling. I mean, do you have more insight into that?
Yes. So, representatives and executives from the hospitals were part of the governance and executive committees of this network that have been meeting. So they were familiar with this whole idea. They were involved. Many were involved from the start, but from their perspective, they sensed that there was so much talk and such a large network of people, and they were concerned that, the county, which is the responsible authority for providing mental health services and the main funder of those services, was not necessarily at the table. They were concerned that there was a lot of talk and that this vision would not materialize. So they felt that at least we'll try to get funding for some sobering services in our hospitals that are already, up and running. So that was their thoughts. So they put in and one of the hospitals, Portland Providence, received funding from Measure 110. They have, I believe, 9 beds. The other Unity Center will have 8 beds. None of those beds are available yet because each of the hospitals are renovating spaces in the emergency department to provide more of a specialized area for sobering. Chris Bonoff, who's executive director of NAMI Oregon, National Alliance for Mental Illness, he told me that, in a sense, he started participating in the network and he stepped back after a while. He thought it just became too grand and possibly too hard to financially support. And even though it wasn't the vision, he said, at least this pushed the hospitals to revamp part of their emergency departments so they could better cater to people with sobering needs.
So would you say that some of the struggle with this group, the Beacon Network, is just a symptom of too many cooks in the kitchen? I mean, you talk about 80 groups, 200 people, a real grand, an ambitious idea that presumably would cost a lot of money to get up and running. But were there just too many people involved in this? Was that a sense that you got from your reporting? I mean, it does, from what I took away, that doesn't seem to be a huge factor. A lot of it was who was going to put up the money to help get this thing off the ground. And what we're hearing from you is, the state through Measure 110 funding turned down this proposal. Earlier, you mentioned that the county from the get-go, despite being sort of the behavioral health authority, was not interested at the beginning of putting money toward this. And so is it a funding thing? Is it just just bureaucracy run amok and just grinding things to a halt, or a combination of both?
I think it was a combination of factors. I mean, the idea was to get what they called a braiding of funding sources. They were thinking, Measure 110 funding from opioid settlements, funding from the city, county, and the healthcare organizations. But I think this became such a political hot potato, which it shouldn't have. There was a lot of people thought that there was a schism between the county chair, then Deborah Kafoury, and the mayor, Ted Wheeler, that also contributed to the lack of any momentum. There was competition for funding with Kafoury's then sort of pet project, the Behavioral Health Resource Center, which was the homeless drop-off center downtown. There was a rift between the needs of public safety responders who really wanted a quick place to drop people off instead of, waiting for hours at a hospital and trying to figure out on the street what someone's ailments really are, whether it's mental health or drugs or where do they belong, versus behavioral health and healthcare. There was also some feeling that, the public safety responders didn't understand the complexity of the funding and regulations for such a center. And what was really glaring was the lack of a single strong champion who could take the lead and see this through.
I mean, what else surprised you during your reporting as you were trying to get to the bottom of why this thing failed to materialize?
So, I usually cover police, and I usually deal with a lot of reluctant sources who, are concerned about speaking. And I didn't expect that in reporting on a sobering center, a public service need for people struggling with addiction and mental health. So I was struck by how political this is. I was struck by the rancor that developed between city versus county leaders. I was struck by the rancor that, how things fell apart because of personality clashes, and how sort of this vision of what's desperately needed in this city sort of took second fiddle. And so that was disturbing. And, a lot of people were initially reluctant to talk because they worried about if what they said could hurt their agency's future funding chances from the county. So I was the whole political hot potato of this. I was surprised by. Maybe I shouldn't have been, but that was disappointing.
And then one of the things that you pointed out in this piece is while this so-called political hot potato is getting tossed around in Portland, and this, I think folks would agree that this type of center or a series of services for people who are experiencing acute intoxication and and other issues, while this is desperately needed here in Portland, you pointed out in your reporting that other communities around the state are opening similar type centers. They're not dealing with the same issues. They're being successful. They've got a timeline. They've got a start date. They've got the funding. And one thing that really kind of blew my mind was that Washington County is opening a very similar sobering center, and they actually got Measure 110 funding from the state to do it. Which just kind of baffles me, but I don't know if you have any thoughts to add on that, or the fact that these needed services are able to be realized and built in other parts of the state, and yet here in Portland, we can't seem to do it.
Yeah, it was a stark difference in Washington County, and that's largely because one government agency, it's Washington County's Department of Health and Human Services, came up with the idea, ran with it, and saw it through. They said, the project managers told me, we own the project from day one. They put together a program development work group, hired a consultant. I mean, it sounds so similar. Drafted a feasibility study, but they got the buy-in pretty quickly from the county commissioners.
Well, and then I guess it sounds similar, but I think what I'm hearing from you too is that they had a champion from the get-go, which is something that you observed was not present in the Portland
Right.
situation.
They had a champion, one government agency that led this effort, and they got the provider. It's CODA. It's one of Oregon's largest not-for-profit substance abuse treatment providers to be involved from the get-go. And they're going to be running a lot of the intensive services when it opens in 2025. So they provided input on, what type of building and the funding mechanisms. They also used opioid settlement dollars as well. And I asked CODA, the head of CODA, did she consider the Portland effort? And she said she didn't feel as comfortable. There were too many conflicting, or too many, I don't know.
Competing interests.
Too many people involved, perhaps competing interests. What did she say? I'm just looking for it. There are many more invested parties, she said. There are many more political interests in Multnomah County, and the timing and the approach, she said, did not really fit with how they wanted to approach this type of expansion.
And I know we're running a little short on time here and probably need to wrap this up. So I just wanted to touch on finally what the status is with this project. Well, what's happening now, and why are things moving in the direction they're currently heading? So
there's a new county chair, Jessica Vega Peterson, and recently the county board provided funding to support a 20-bed, what's called a stabilization center. And that's a place where people would voluntarily show up and spend 30 to 90 days. And this is like down the line after someone's already been discharged from drug withdrawal treatment or other acute treatment. Beyond that, Unity Center for Behavioral Health and Portland Providence hospitals are providing a total of 17 sobering beds in their facilities. Unity said they expected to open their beds by the end of this year, but they didn't have a date. And Portland Providence is expected by April or March. And then separately, at the urging of Commissioner Julia Brim Edwards.
That's Multnomah County Commissioner, right?
Yes, Multnomah County Commissioner Julia Brim Edwards. The county chair agreed to allot like $150,000 in funds to allow the commissioner to come back and propose a plan for a strict sobering center to come back by March of next year with a plan to propose money for the next fiscal year, 2024-2025.
So that means that the county is now discussing, or the new county chair is open to the idea of the county funding a sobering center at this point. But she's also tasking Commissioner Brim Edwards with coming up with a different plan altogether, or do you think it's going to have elements from the initial Beacon proposal?
Well, hopefully, Sharon Mirren, also a county commissioner who was involved in the whole Beacon network from the get-go, is working with Julia Brim Edwards, and she envisions sort of a 50-bed strict sobering center that could grow into more later on. But for now, they are working to come up with an idea or draft a proposal for more of a stricter sobering center that might not deal with people in acute mental health crisis, even though others are questioning, well, how can you separate out the two? Because often people are suffering from the co-occurring problems of intoxication and mental illness. So they're seeking out ideas from others. And recently the county board had a meeting in November and brought in a panel of Gresham and Portland police to provide their ideas on what's needed, even though, police were involved for more than a year in trying to get a center up.
So do you get the sense, are we back to square one with planning and envisioning a sobering center after 4 years? Is that your sense, or can a lot of the work and the people that were behind this initial effort help shape and inform this next iteration? Or what are your thoughts on that?
Well, I think there's a lot of people. Now Bob Day is police chief, and I think, there's still Sharon Mirren's at the county county board table. There's a lot of people still who were involved in the initial Beacon who could be tapped to help provide their ideas and their knowledge. At the recent county hearing, it felt like they were starting at square one, which is remarkable. Making sure, one county commissioner asking if anyone with lived experience was consulted. There was a whole directory of dozens of people with lived experience that met for hours. So I'm hoping that the county recognizes that they can tap into all this work that had been done to propose this future sobering center.
Max Bernstein, thanks again for your time today and for talking more about this article.
Thank you. Appreciate it.
Thanks so much for listening to Beat Check with the Oregonian. If you like this show, give us a 5-star rating and review on Apple Podcasts. It really helps people find the show, and tell a friend. Help spread the word. The best way to support our journalism and stories like this one is with a subscription to the Oregonian Oregon Live. You can do that at OregonLive.com/pod support. Until next time.